Hello, I'm Tom Johnston, the owner and designer of the Mechanical Advantage stretching harnesses. Thanks for checking out my YouTube and giving me this opportunity to properly demonstrate the handling and operation of the Maxim stretching harnesses. I'd like to start with a knee extension. This is it right here. Let me stand up and take it apart so you can see it comes basically, it's in two parts. There's the harness and the anchor platform. I'm going to unhook this from the platform like that. This is actually the pulley system itself. There's a pulley system on each side and it's connected by one handle, and you'll see that in operation here shortly as I get started. The anchor platform, basically behind these little neoprene tubes, there's just two eye bolts. Okay, and those eye bolts are where we're going to place these hooks. Okay, like that. And the weight of your body on a chair holds this anchor, that's what anchor platform down. And basically, if I show you the fast operation of what's going on, how it works, you can see as I lift up on the handle, you see how it's lowering the harness, this pulley system. Okay, you're going to start up here, get your leg underneath that, I'll show you in a second. And then as you raise the handle's pulling on each pulley system on each side and lowering it little by little by little to straighten your knee, to straighten your leg. Okay, so that's the two parts right there. This is a new addition, having this support for your leg. For many, many years, they just used a stool out here with a towel, which I'll show you that. There's two different ways of doing it. You don't have to use this. The reason why I designed this and these neoprene loops is to keep the harness from getting tangled. And if you're a physical therapist and you're in a hurry between patients can get these things tangled up, so I wanted to make this thing foolproof. So now these hooks can no longer fall out of those eye bolts. They are going to stay put. And by putting a buckle on the handle, as long as you put this handle and buckle it together, there's no more loose handle to get tangled. The hooks can't get tangled around each other, and the handle can't get tangled in the buckle as long as you hook this handle back into that buckle, okay? So if patients get done and they do these things and they just drop it in a pile on the floor, which happens all the time, you can just pick it up and it no longer ever gets tangled, okay? And again, the stool helps when you fold the whole thing up without these neoprene tubes holding the hooks in place. When you would stand it up out of the way in between patients and put it against the wall, the hooks would fall out and the harness would be a big pile on the floor. So these last additions have been very favorably received from all the physical therapists. They love the new design. So quick and easy to set up, never tangled anymore. It's just ready to go for your next patient, as simple as that. Now let me show patients how to get in this thing at home. If you're taking one of these things at home, let me get it out here where my friend can film it. What you can do, as you see I put two of these slash marks on the platform. That just gives you an idea where the chair is going to go on the platform. It's going to be somewhere for the length of your leg in between these two marks. And after a while, you'll know, you'll see exactly where you've got to get it set up, because the idea of positioning where I sit down, I want my knee, when I put it up on either that stool or this stool, to be directly above the eye bolts. I don't want your knee out here. I don't want your knee back there. So when you get yourself set up at home with your chair, I want your knee directly over the eye bolts. So when you start to activate the harness, I want the harness to push straight down. I don't want to see an angle in the V and the lines, all right? I should be pretty close to right there, directly over the eye bolts. You don't want to be way like this, because then if you tighten up, sometimes it'll have a tendency to slip off the knee. Okay, you just got to get it close. It'll work just fine, like that. Now, if I've got some loss of range of motion here, like I'm stuck at 10 degrees, minus 10 degrees, right? You can see what's going to happen. I'm going to, actually, let me start right from the beginning. Let's just start all over again. I'm going to hook this back together, show you the parts. Now, if you're very limited in your range of motion in your leg, and you might not have good balance, with this stool in here and those hooks in place, the one bad thing about this setup is you've got to have something to hold on to at home, especially if you have a balance issue, because you have to get your leg through here. That's the only negative thing with this new setup of keeping things so they won't tangle. Okay? But I'm going to show you a different way around that. Okay, you're going to put your stool back in place now that you've got you step through. So you're inside. Now help your leg up. Help your leg up on the stool, like this, okay? Now unbuckle the handle. And as you start to lift up on the harness, you're going to position the kneecap right in the hole of the harness there. As you lift up, and I would just lift up till it starts to hurt a little bit, okay? You can see I'm holding onto the buckle to lift up. Now grab the handle, right at the cord lock on the handle, right about at the base in the center, and just slide it down. And this is what locks the lines. You push down that ring. That locks the lines inside. Now, this is important to keep the harness from tangling. Return this to the buckle, okay? I always like to check the line lengths to make sure I haven't shortened one line more than the other. Remember, these pulleys have to go down evenly or it'll twist the harness off center. Okay, so you know you did good right there. Now you're ready for your first pull. You feel a little tension on there, a little bit of pain. Just pull up just a little bit more. Okay, I'm grabbing the handle, both hands. Grab the handle, not the cord lock. Both hands, so it hurts a little bit more. Now just hold these lines up here. Hold them. Don't pull. Push down again. Grab the handle right there at the base. Push down and lock it again. Okay? Now after 2 or 3 minutes, the pain will diminish and you're ready for another little pull. Again, don't pull on the lines. Pull the handle. Both hands. Pull up till it hurts again a little bit more. And now just hold these lines. Push down on the handle. Lock the cord lock. Okay? This whole procedure might take 10, 12, 15 minutes. 2 or 3 minutes waiting for the pain to diminish. Another little tug till it hurts again. But the harness is doing all the work for you. You can do this in front of the television, at the computer. It makes it so much easier for you to stretch, and it's doing all the hard work for you. This pulley system is extremely powerful. You can push a lot of force, and it's just effortless to hold for you. And all 4 of my designs, all 4 of my harnesses work the same way. Okay, now when you're all done stretching, I've got to remember to tell you this. This is so important. I like to return this back to the start like that. Okay, you pull up on the handle. And see now I've returned the pulley system back to the start position. That's where it's ready for you again or the next patient, and it can't tangle. I just want you to take a couple minutes rest because you're going to be in a lot of pain at the end. But right now, you've got some new range of motion in there. You've done all the bulwark to fatiguing the scar tissue. One of the most important things at the end of taking all that time and effort to stretch, I want you to exercise in the harness just a little bit here at the end. I want you to try to do 6 or 8 repetitions using your muscles to try to straighten that knee out. And you're only going to use the harness to assist you. It's kind of like when us men, when we're bench pressing, when you get to the last rep, you have your partner just put his fingers under the bar just to help you squeeze out that last repetition. Well, now you're going to use the harness. After you've taken a break, you're going to tighten it up again. You're going to plug it back in. Okay? Okay, now I'm going to try to use my quad muscles. These are quad sets now with your quad muscles. I'm going to try to straighten my leg out with my muscles as much as I can. I'm just going to give a little assistance with the harness. This is called active assist. Just try to do it all on your own, but at the last couple degrees, you're going to need a little bit of help with the harness, okay, like that. Then take a break, 10 seconds. Then try to do another repetition, using your muscles, just a little bit of assistance with the handle to do another repetition. And if you do a set of 6 or 8 reps, maybe the following week you can do a second set. You've got to re-strengthen these muscles to overcome that scar tissue. So you can you won't be limping any longer. This is so important to do at the end of that stretching, is to use the harness to assist you to exercise, okay? Okay, now again, when you're all done, I'm just going to pull up on the ring, slide this back to the start. I'm going to pull up on the handle and return all the line back into the pulleys. And you can even drop this on the floor. It can't tangle anymore. If you need, if you need to get out, you can drop it on the floor if you're hurt, and you just pull your leg out, like that. Or you can stand up again, like I did getting in. You can stand up and just back out. And then when you're all done, you can just put the harness like this. If you're at home, you're going to probably leave it like that at home. Okay? And you're just ready for your next stretch. And again, put this by the TV or by the computer. Don't hide it in the basement. Put it. It's so easy to do. Put it someplace where it's going to be to help you, encourage you to stretch 2 or 3 times a day. All right. That's the knee extension. Oh, I've got to give you my website address. Would be www.mechanicaladvantage.us. Okay, and you should come up with these YouTubes. And now I'm going to move on to the next harness. Thanks. Thank you very much.